Good evening, everybody. Thank you for being here. It's really a pleasure to talk to you tonight. We're going to present some science over the next 30, 40 minutes or so, but I really think it's important as you're listening to these slides that we recall the words that Mr. Clifton just made to us, that this disease is more than the science and the technology, but we're at a place where we can bring this kind of science to the community, and it's a wonderful partnership to marry this kind of science that we do, the cutting edge research that can happen at a university like this, and apply it in such a tangible way to this disease, and hopefully make an impact in your lives and the lives of the people who come after us. So I was assigned to talk about the past, present, and future of brain imaging in Alzheimer's disease, and this will be a fun topic for me. I'm going to spend most of my time talking about tau imaging and amyloid imaging. But just to give you the lay of the land of where we are with our center, 80% of the people who signed a consent form, are still taking part in the study, and that's tremendous commitment from you guys. We really appreciate that. 76% of you have had an MRI, and this is an incredibly important piece of information for us to understand this disease. 53% have had a spinal tap, or lumbar puncture, I should say, to get spinal fluid, and that number keeps growing. 81%, as Dr. Asana mentioned, have participated in brain donation, and of course, all of you have given some of your blood for DNA and gone through our arduous cognitive testing. We really appreciate that. It's only by integrating all of this and looking at this across groups of people, socially diverse groups, people with different socioeconomic status, people who exercise and people who don't, people who eat certain ways and people who don't. We're going to be able to put all of these things together to come to some answers about why some people get Alzheimer's disease and some people don't. First of all, let's just get on some common ground here about what Alzheimer's disease is. When you think of AD, you may be thinking of someone you know, and you have a face and a lifetime of memories in mind of this person. Just getting down to the cold hard data, though, Alzheimer's disease is plaques and tangles, and that's what you see here on the left. Those little darker blotches are the plaques that are in the brain, and they're on the right. Those little dark speckles are the neurofibrillary tangles that are living inside of somebody's hippocampus. And this is the kind of information we get from autopsy, and this is why brain donation is so important. For, up until now, this has been the only way we can truly know who has Alzheimer's disease. We can make our best educated diagnosis in the clinic, and we are usually right, but sometimes we're not, and I'll show you some examples of that. We're at a place now, though, where we can maybe make this diagnosis before someone dies, and we can know definitively. And it may be that we can even make this diagnosis before the symptoms appear. That would be amazing, because then we would get the right people into clinical trials. We would be able to make our most pinpoint accurate correlations between things like exercise and amyloid and tau, or the neurofibrillary tangles that show up in the brain. So we can get plaques and tangle information from these new PET scans. We can get it from autopsy after a person has passed away, and PET scans and spinal fluid while a person is alive. And I think if we can do it while a person is living, and understand and learn from them and talk to them about their lives and assess them, we will learn so much more. This is important because that first curve there is amyloid, and amyloid plaques are the driving force in Alzheimer's disease. These things show up way before someone gets MCI or dementia. They start showing up in our 50s and 60s. And then shortly after that, this tau signal, also called neurofibrillary tangles, the plaques and the tangles, that starts showing up as well. These things happen before the symptoms begin, and this is really critical. While we were in London, there was some work presented on a new, kind of a way that's been brewing for a while, a way of thinking about Alzheimer's disease. This is a disease that's defined by plaques and tangles. And you see these A, T, N's. A is for amyloid, T is for tangles or tau, and N is for neurodegeneration. That's the effect that the amyloid and the tau tangles have on the brain. It degenerates the brain. So you can have these in any combination, and you can be unimpaired, you can have MCI, or you can have dementia with these things. And if you have dementia, but you don't have amyloid, that means you don't have Alzheimer's disease. Your dementia is due to something else. And again, for a while, up until now, we've just had to make our best case, and in some cases, make our best decision, and in some cases, what we thought was Alzheimer's disease turned out not to be the case, and I'll show you an example. Well, let me just get into the history of how we got to where we are with this remarkable new kind of imaging. CAT scans or CTs is what was the tool of the available tool in the 80s and even into the early 90s. This cannot identify plaques and tangles, but it is useful for assessing other causes of cognitive decline, like strokes and tumors. MRI, similarly, has been used clinically. We get it on nearly everybody that comes to the clinic, either an MRI or a CT scan, just to rule out something else that might be causing cognitive trouble. And MRI is super useful in helping us understand the second leading cause of cognitive decline, and that is vascular cognitive impairment, vascular disease in the brain. And then the third modality that we'll look at are these new PET scans. These can identify plaques and tangles. They need validation. They're new. That's why we're doing research on them. They're not deployed in the clinic in broad scale yet, but they soon will be, we believe. So this is an example of what these the old CT scans or CAT scans look like, and we still use these, again, every day in the clinic to assess this disease and rule out other causes of cognitive impairment like strokes and tumors and things like that. It's not very expensive to do. You can see the images kind of fuzzy compared to what I'm going to show you here, which is an MRI. This is a person, and this scan can be sliced in any way we want to look at any part of the brain that we need to look at, and it's a very powerful technique. It's used in the clinic to rule out, as I said, other causes of symptoms, and there's a pattern of what we call atrophy or a pattern of degeneration that you might see on this scan that helps us be reassured in our clinical diagnosis of Alzheimer's disease. But an MRI scan itself doesn't tell you if a person has plaques in their brain. And so let me go on to what MRI is good at, which is helping us understand the flow in the brain. And let me see if I can get here. So it's good for understanding the anatomy, and it's good for understanding whether blood is flowing appropriately in the brain. And this is a technique that was developed at the University of Wisconsin by one of our colleagues, Oliver Wieben, who's a professor in the Department of Med Physics. With this kind of technique, we can get a sense of the vessels that feed the brain, and these vessels can be compromised by many, many things: our diet, our lifestyle, or genetics, and these things, we believe, can impact your brain's ability to clear amyloid and these tangle proteins out of the brain. And so something like vascular disease becomes an important thing, not only as a co-occurring pathology to Alzheimer's, but maybe even as an instigator of sorts for Alzheimer's pathology. So we're able to look at this kind of thing and get exquisite detail on the vessels of the brain. And that's this example up here. Here's some more examples of MRI. This one here looks at what we call ischemic lesions. That is areas where there's just less blood flow, and it causes these lesions on a certain type of scan, and that helps us understand if vascular disease is present. And again, vascular disease is the second most common cause